And so what has emerged in the last several years is a recognition that patients can have various patterns of radioiodine-refractory disease, as illustrated in this cartoon by my colleague Maria Cabanillas and her co-authors Dave McFadden and Cosimo Durante. The easiest conceptual description of refractory disease is shown on the left, patient with multiple foci of tumors in red, indicating they have no radioiodine uptake. On the right is perhaps the definition or characterization that makes the most sense to an oncologist rather than an endocrinologist, and that is a patient with multiple foci of disease in green, meaning there's radioiodine uptake, but in fact the disease progresses and grows despite radioactive iodine therapy. And in the middle is perhaps one of the more controversial ones, or where there's question of benefit, where some of the lesions are radioiodine avid and others are not. But the lesions that are not probably represent the leading edge of the disease and where the problems are going to emerge for that patient. So fundamentally, the lack of uptake or the lack of sufficient uptake to permit an effective radiation dose to the tumor defines or characterizes radioiodine refractory disease. Now, of course, it's always important to make sure that the patient does not have false negative scanning, that there isn't interfering amounts of iodine, non-radioactive iodine on board, that the patient is adequately TSH stimulated, et cetera. But assuming that all the radioiodine imaging and therapy has been done correctly, these would really describe patients for whom we need to think about other therapies beyond the classic radioactive iodine.